Patrick's head would have taken the main impact of the blow, potentially fracturing his skull. 2-year-old Adam had been playing in an upstairs bedroom when he climbed out of the window and fell 15 feet onto concrete.
Is that your head, buddy?
My head.
Ambulance.
Oh yeah, there's a child who's been run over by this. Very
Are they
responsive.
breathing?
Yeah.
Are they awake?
No, it's a child. He's been run over.
Stop there for me. Is their breathing noisy or abnormal?
It's noisy.
An ambulance is already en route to the incident, but with a child's life in danger, Dr. Adam and Ian are also immediately dispatched.
So we're going to Brierley Hill to a 10-year-old who's been on their push bike hit by a bus by the sounds of it.
The boy has been reported as conscious and breathing, but there are no further details.
This is a high-risk incident for major trauma, so anaesthetic on the roadside if they need it, splinting and stopping bleeding, blood transfusion if they need it.
The potential for serious injury is considerable.
Updated assignment.
Arriving at the location, Dr. Adam and Ian are met by the tactical incident commander, who briefs them on what he's discovered so far.
Well, we was cycling alongside the bike and then somehow gone underneath.
Okay.
It's been dragged off, a couple of metres, but what we've gathered is it's fallen off sideways, so it's not gone underneath the bus.
Okay.
Patient playing some abdos.
Okay.
The boy was coming out of a cul-de-sac on his bike when he collided with the bus. Passers-by say he was initially knocked unconscious, but that he didn't go under the wheels.
Is he on the back of the
ambulance?
ambulance?
Initially, when he got there, he was kind of up and trying to move away. He was like agitated. He got some distension to his umbilicus region,
Okay.
and he's complaining of left pain in his proximal femur. But there doesn't seem to be any distension. All of his clothes are cut off except for his pants.
Hi guys. Hi Tyler, my name's Adam. Right, I'm doctor with the ambulance service. Is it all right if we come and have a look at you? Is that okay?
10-year-old Tyler wasn't wearing a helmet and has cuts and bruising to his head.
Yeah. A bit tachycardic.
Tachy or tachycardic means a fast heart rate, a sign that Tyler could be bleeding internally.
How about these legs? How do they feel? Can you lift this leg up as well, Tyler? OK. Can you bring both legs up together? Does that cause you any pain? OK, all right.
Tyler, your mum's just outside, OK? Yeah. All right. She knows that you're nice and safe. She knows that you're doing really well, OK? Right. Is it all right if I pop a little blanket over you just to keep you warm?
Get you a bit warm, buddy.
All right.
There you go. You've been very brave, haven't you?
I mean, he's airway intact, his eyes open, he's got moving all four limbs, a bit tenderness there, but doesn't feel particularly guarded or rigid, pain in the left knee.
Tyler didn't fall under the wheels, but witnesses say he was dragged along for a few meters and was knocked unconscious.
But he's been dragged up. I still feel...
You want to what, sorry, Tyler? You off to Mum?
Yeah.
OK. Is it Anna, is it? Are you Tyler's mum?
Yeah, and that's his dad. That's his dad. I've had to phone him from work because he does quite late hours.
OK.
Tyler's mum, Anna, was at home when she got the call every parent dreads. By the time she arrived, her son was being treated in the back of the ambulance.
I'm Adam, I'm the doctor with the ambulance service. OK, Tyler's OK, he's conscious, he's talking to us, he's asking after you, OK, which is a good sign, yeah?
I just didn't see, I thought he's dead.
He definitely isn't, OK?
Right.
He's doing really well, OK? I just need to know a little bit more about him so I can make a decision about what the best hospital is for him to go to, OK? Does he have asthma?
No.
Any problems with his breathing?
No.
And has he had any medication today?
No.
On board the ambulance, Ian is monitoring Tyler's condition.
How old are you, Tyler? You're 10. Do you know when your birthday is? In March. OK, all right.
By asking questions, Ian is looking for signs of confusion that could point to a brain injury.
Yeah, I know, mate. Should we try and get you some medicine to take that pain away?
Yeah.
Yeah, OK, mate. Let's try and have a look at that as well.
Outside, Dr. Adam takes another look at the bus to try and work out exactly what happened.
Once we can see the bike's being dragged. Here.
OK.
So we flexed him from here.
OK.
Is that your head, buddy?
My head.
Whereabouts in your head?
Is it where I'm holding?
Yeah.
Is that better now?
Tyler's head is completely immobilised to protect his spine on the journey to hospital.
You want to go to sleep? You can close your eyes if you want, Tyler. What we might do is just keep asking you questions, though, OK? Good man. Good man. You feel a bit sick? All right. You going to be sick? Should we get you a little bowl?
Before they set off, Dr. Adam checks Tyler's abdomen once more, looking for signs of bruising or internal bleeding.
So we go BCH. He looks fine, his heart rate's coming down, he's just a little bit drowsy now, feeling a bit sick. So BCH based on mechanism.
As Dr. Adam can't rule out a serious head injury, he decides to take Tyler to Birmingham Children's Hospital, the region's paediatric major trauma centre.
He's doing fine, we're going to take him to the Children's Hospital. It'd be helpful for one of you to come just help. As I say, it'll be a case of them checking him over.
Tyler's mum will drive to hospital. But before they all set off, Ian updates control.
No, we're going to be conveying this patient on balance. We'd rather get him checked up at BCH.
Thanks very much, and I'll pass the alert now for you.
The hospital is a 20-minute drive away. Adam travels with Tyler to carefully monitor his vital signs.
Tyler? You okay? Yeah, good lad. I can't see any evidence of a tyre going over him, thankfully, because that's normally what causes the damage, so I think he's been very lucky, really. Tyler, we're at the hospital now, OK?
Waiting for him when he arrives is his mum.
Are you right to get him checked in with Mum? Is that all right? So we'll just take him in. They'll obviously check him over. You just need to get him registered with his name, date of birth and address and so on, OK?
Tyler will be seen by the trauma team to make sure he has no internal injuries that aren't obvious.
Well done, Tyler, OK. He wasn't wearing a helmet, so he was lucky he didn't hit his head badly on the pavement. The glancing blow knocking him off his bike, and then a bit of a combination of him hitting the side of the bus and then hitting the ground. So hopefully he's lucky and hasn't done himself any major injuries.
Ambulance services, the patient breathing.
This lad just ran out across the road and I've hit him with the car.
Okay. Where's the pain that he's feeling?
Where's the pain? In his leg.
Is he in the road still?
Yeah, we're in the road.
You're okay, left. 13-year-old Patrick, hit by a car, patient is still in the road. So, yeah, we haven't got a huge amount, we've got an age. The rest we'll have to figure out once we get to scene.
An ambulance has been dispatched, but with the child's life in danger, Pete and fellow critical care paramedic Mike Andrews are also urgently needed.
We'll be there first, won't we?
Yeah, we're going to be the first resource on scene, which is a bit unknown at the minute.
In a 12-hour shift, Pete and Mike will attend up to 8 emergencies. Their skills and training can make the difference to someone surviving or not, but only if they get to them in time.
That's completely blocked that way, Mike, by the looks of it. Some of this might just be general traffic, I don't know, or it could be because of what's happened.
In these freezing conditions, Pete and Mike will need to act fast to stop the child's injuries becoming critical.
Can't go the wrong way around over there as much as I want to. Going to park us just in front, okay?
I'll press us in attendance. Mike, shall I get out and jump and have a quick look?
8 minutes after receiving the call, Pete and Mike are on scene.
Morning, how you doing? All right? Hello, Patrick. Hiya, mate. I'm Peter. I'm one of the paramedics with Westminster. Are you Mum?
Yes. Hello, Mum.
Listen.
13-year-old Patrick was walking to school when he stepped off the pavement into the path of an oncoming car.
We're going to have a look at him. We're going to look after him for you, all right? We've just got here ourselves. He's talking to us. That's a good stop. Are you hurt?
Just my ear.
Just your ear? OK, let's just have a quick look.
It's common in car versus pedestrian road traffic collisions for the pedestrian to have sustained multiple injuries. Using their enhanced trauma training, Pete will need to assess him quickly to prioritise treatment.
Can you move this arm just gently? Yeah, you can move it. Can you move your right arm? Shoulder. Your shoulder hurts. And what about your legs? Can you move it a little bit? Don't move it too much, as long as you can move. OK, all right.
Patrick is able to move his arms and legs, so Pete can rule out a serious spinal injury.
OK, all right.
But the blood coming out of his right ear is a major concern.
It's a hemorrhage just out of his ear. I'll give him an update, mate.
All right. So potential for a base gun until we investigate it further.
Pete and Mike suspect Patrick may have fractured his skull, resulting in a build-up of blood in the brain. If so, he's at grave risk of a stroke or potentially fatal hemorrhage.
Happy to pass an ethane.
Yeah, mate.
Crew on red backup, just to see we'll get him out the cold, all right. Just looking at the car for some indicators of how hard the car has hit him and potentially for injury patterns, really. So where he's obviously gone onto the bonnet, but the windscreen is intact. So he's got a head injury and some bleeding from his ear, so we need to look at that quite quickly.
It's likely Patrick's head would have taken the main impact of the blow, potentially fracturing his skull.
Patrick, do you think you were knocked unconscious at all? No. All right, mate, just have a look, just a second.
Checking his pupil's reaction to light will show whether he has suffered a concussion.
Have you got any pins and needles anywhere? No? OK. All right. How bad is the pain at the moment?
What ear?
Your ear, is that the worst pain? And what about your shoulder? Is it just when you move it? OK, all right, no problem. The ambulance is here now. What we're going to do, we're going to get a proper look at you in there, all right?
Pedestrian, 13-year-old male, struck by a car.
As West Midlands ambulance crew arrive on scene, Mike updates the critical care trauma desk on Patrick's condition.
Query basal skull fracture. Well, the patient is conscious and talking to us. He's just got a bit of a hemorrhage coming from his right ear.
Now the ambulance is here, they need to get Patrick to hospital as quickly as possible.
He's got a head injury. I think we need to, we'll get him immobilised. Yeah. So if you could grab your stretcher and scoop. We haven't stripped him off because he's going to get freezing cold.
Yeah.
So are you all right with that? Is that OK? All right.
Let's do a few little checks on you, OK? See how you're doing.
Peter and Mike need to be sure they don't aggravate any undetected injuries when they move him.
I think without the collar, yeah, but what we'll do, he's moving it, just keep your head nice and still, Patrick, that's it. He's moving his head freely and he's moving all his limbs free, he's got no paralysis. We'll have to get this bag off, I think, so it might be just a case, we'll have a look at that in a second. Has anybody got any shears on them?
Keeping Patrick as still as possible, Pete oversees the ambulance crew as they position the scoop stretcher underneath him.
Any pain in your tummy? Nothing? No in your back? Lower back? That's good stuff. OK. Right. Just let us do all the work, Patrick. OK. We're going to just... There's going to be a little bit of movement, mate.
You're going to feel pinch and fleek, all right with it?
All right. Now, it might pinch your bum. Tell us if it does and we'll stop.
You got his head just clear of that, mate.
Okay.
Once the two halves are snapped together, Patrick's head and neck must be immobilised.
Yep. OK, mate.
Before it is safe to move him onto the stretcher.
Got some grazing to the temporal region there. The other thing we need to have a look at is his sort of upper thigh pelvis region, because where the dent is on the bonnet, it looks like that's where it's struck him. Yeah, if that makes sense. So, ready, steady, lift, and ready, steady, down. OK. So that's you're right. All right. Nothing to worry about. We're going to look after you. OK. OK. Going feet first, then. What we're going to do, we're going to take some of his clothes off, all right? Yeah.
On the ambulance, Pete can oversee a full body examination. He's worried Patrick may have broken a bone in his pelvis, which could rupture the femoral artery, causing him to bleed out and die.
Take a nice big deep breath in for me. Big deep breaths in. It's clear. It's equal. OK. So I've checked his pupils, they were leaking and reactive right. He's got an abrasion to the top of his the right side of his forehead, and he's got this blood coming out of his ear that I can't see where it's coming from. So in terms of hospitals from here, he's nice and stable, but just because there's blood out the, out the ear, I think sway towards the children's. What do you think?
Yeah, I think.
OK, right. So he's, I've checked his pupils, they were leaking and reactive right. He's got an abrasion to the top of his the right side of his forehead, and he's got this blood coming out of his ear that I can't see where it's coming from. So in terms of hospitals from here, he's nice and stable, but just because there's blood out the ear, I think sway towards the children's. What do you think?
You're going to pay a pinch and fleek, all right with it?
Patrick is alert and doesn't seem to have broken any bones. Pete is happy he is stable enough to leave him in the care of the ambulance crew to take him to Birmingham Children's Hospital to be further assessed by the emergency doctors.
Ambulance services, patient breathing.
So. It's not. Please, my baby keeps stopping breathing.
All right, sweetie.
Please, come on.
All right.
Good. 69 come through the 17-month-old cardiac arrest.
In Walsall, Kerry and Ryan have been dispatched to a young child who's struggling to breathe.
6-2, roger. RETA showing currently 1:04:14 minutes.
If the child's not breathing, they're in danger of going into cardiac arrest and may need life-saving drugs.
So just confirm, with 17 month, is that right? Clear.
Every second counts. Ryan quickly checks the correct paediatric doses, which vary depending on the age and size of the child.
Updated assignment.
1.1 mil, 1 milligram in 10 mil. Clear left.
Thank you.
5 mils per kilogram, is it? In
Not in medical.
cardiac arrest.
Moments later, a call comes in.
6-2.
6-2, apologies, guys, you can stop now. Conscious of breathing about.
That's great news, thank you. We'll stand down.
Being stood down is part and parcel of the fast-moving world of extreme emergencies.
After all your workings out and everything.
And feel sick. Not a reflection on your driving, Kerry, just my motion sickness while eyes are in.
With the baby out of danger, an ambulance crew now on scene will take over ongoing care.
Get your belt back and get your cup of tea.
Ambulance services, the patient breathing.
Yeah, he is. He's 2 years old. He fell from the window upstairs.
Take a breath for me. Stay nice and calm for me. Is that him crying? Don't pick him up because he's fallen from such a height. We don't know what injuries he's got, okay? Now the ambulance crew, they should be arriving there with you shortly.
It's every parent's worst nightmare, and with a child's life potentially at risk, the critical care team, Stephen Mitch Mitchell and Peter Bowles, are immediately dispatched.
People always wonder why kids fall out of windows. It's to do with the fact that they've got slightly bigger heads, and being a 2-year-old, quite inquisitive looking out, the weight just carries them over.
Every day, a child in the UK is admitted to hospital after falling from a building. Injuries range from broken bones to major head impacts, which can cause long-term brain damage.
If the child has fallen out of the window, they're eligible for transfer to a major trauma centre.
6-2 crew on scene, asked if you could continue for now.
7062, we are ETA in 3 minutes.
An ambulance has already arrived at the scene. The critical care team are briefed by the crew.
Hiya.
Hello, right. So he was round the back in an upstairs window and then fallen onto a floor similar to this.
Concrete, yeah.
Yeah. His obs actually seem okay. We can't see any obvious injuries on him.
2-year-old Adam had been playing in an upstairs bedroom when he climbed out of the window and fell 15 feet onto concrete. To help Adam feel more comfortable, Mitch has pulled down his face mask.
Hello, are you Mum, are you? What's your name? Naneefa, okay. So, what time did this happen?
About 10-15 minutes before I called the ambulance.
Okay. Have you had a feel round his head and that?
He fell from the window and landed on his side.
On his side, yeah. Yeah.
Although Adam has no visible signs of harm, Mitch wants to be sure he doesn't have any internal injuries.
I think with everything that's happened, you need to check up at the hospital to make sure he's all right.
In the meantime, Calpol, a paracetamol syrup, should help to ease any pain Adam's suffering.
So we'll give him a little bit of Calpol just to cheer him up a bit. And so he's 2, so 7.5 is what we need. And we'll give that to Mum to give that to him. OK. Oh, so this is just normal Calpol. It's OK. It's only a bit of medicine, mate. Well, yeah, don't worry.
Adam is refusing the medicine.
Everything all right? It's for you to get onto the ambulance. Have you got some shoes?
Can you just give him 5 minutes to quickly grab some stuff? Like
Look,
for him
I think it's probably better that we just sort of get him on and then get somebody else to follow up to the hospital, OK?
Getting him to hospital is now the priority.
OK, Adam. If you want to come straight onto the ambulance for me. Bye. Bye. OK then, Mum. So ideally he needs to go into this. What I'm going to suggest that you do is, like, you shuffle your bottom up the bed a little bit more, and then just rest him onto there. It's OK, mate. I don't think he's going to go in, personally.
But trying to get him in is making Adam even more upset.
Personally, I would sit the lady in that rear-facing chair with a seatbelt on and, like, as best as you can, and that's all you really can do. OK, you happy with that?
With Adam stable, Mitch hands him over to the ambulance crew, who will transport him to hospital.
Obs are all normal, crying, GCS 15.
Yeah.
Very grumpy, 36.9. Okie-dokie. He doesn't seem in excruciating pain or anything like that, and he looks well, so I'm sure he'll be fine, but he needs a check-up, all right, because he's fallen.
At the nearest trauma unit, doctors will be able to check Adam to ensure there are no hidden injuries.
Generally, when you've got a child who's kicking and screaming, you know they're sort of fairly well as such. If he was grunting, that would be more of a concern. So it appears to have got away uninjured, but he's definitely fallen from the window. So we had to try and get him to the hospital as quickly as possible.